Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just joining us, we are talking about ear infections. We've got Express Care's Dr. Jitka Lom here in studio to answer now some of our viewer questions. Our first question asks, how do I know if my toddler has an ear infection? It just seems like she has a cold.
Well, that's a fantastic question. And you know, she might have both. She might have a cold and she might have an ear infection because, like we mentioned earlier, 80% of ear infections are a cold in the middle ear. So, but here's how you know whether you need any attention, okay, from the doctor. If your child has a really high fever, they're not eating, they're not drinking, they're vomiting, and they're looking sort of very lethargic, meaning they're not really interested in doing anything, then you probably need to get your child checked. Otherwise, if you just give your child Tylenol for the pain, because it is really painful, ear infections hurt a lot. Okay, Tylenol for the pain, and then maybe a little Benadryl, which is super safe, and that can be used for a decongestant, so to try to dry up the nose. Those are good home remedies that you can use while you're waiting for this thing to get better on its own.
Okay, our next question asks, does putting oil in my son's ear really help? Is it safe?
Oh, yes, it's safe. You can warm up a little
oil.
Coconut oil, olive oil. Yeah, it's safe. Usually not baby oil, okay? That usually doesn't work. It's a very light oil. It doesn't work very well. But coconut or olive I can think of. Those ones, if you warm it up a little bit and you put it into the ear, that helps melt the wax, and that's a good way of like cleaning out the ear. And also it might be soothing if your child has a little middle ear infection. It can feel nice. Now you don't want to put anything too hot in there and burn your child, but just warm, you know, like skin temperature. Yeah.
And does it just drain out itself?
Yeah,
or?
then you basically put the drops in there, wait, 5 or 10 minutes, just wiggle the ear a little bit so that it goes right in, and then when you turn over, the wax will sort of flow out.
Okay.
Be a little messy.
And don't be sticking Q-tips or anything in there.
You can use a cotton ball, or if using Q-tips, we were talking, just put it on the outside of the ear, just a little bit, but don't dig it all the way in.
Okay. All right, the next, and we kind of answered this earlier, is how can I prevent ear infections in my kids?
So keep them away from cigarette smoke. Try to prevent them from getting colds by teaching them to wash their hands and wipe their noses. And then, yeah, that's another thing. You can teach your child to blow rather than sniff. Okay, and that's helpful because when you sniff, you're sniffing the germs and the mucus back up into that eustachian tube. So teach your child to blow their nose and then throw it away and then wash their hands.
Okay. The next question is, my son gets ear infections regularly. When will I know if surgery is necessary?
Yes, and sometimes despite all your best efforts, you've done absolutely everything right, and your child still gets lots of ear infections. So the guidelines are that if you are getting more than, let's say, 3 or 4 infections in a year, and you keep having to do antibiotics over and over again, you eventually will need to get a little tiny surgery done. And this is really easy. What they do is they put a tiny hole in the eardrum and then put a little tube in there. And what that is a drainage tube. So remember we were talking about the eustachian tube here full of mucus that can't go out because there's an eardrum. Now there's a little hole in that eardrum that helps ventilate. So the mucus can travel more easily, the pressure doesn't accumulate, and those little tiny tubes stay in there until the child grows big enough that they just drop out. So they don't have to be removed, they just stay in there and then drop out on their own after about a year or 2. So we call those myringotomy tubes, and that's a surgery that takes about 10 minutes. They just put a little mask on your child and then use a tiny instrument with a microscope to put a tiny hole in the eardrum and a little tube. And then that'll ventilate it, and then you'll be done with middle ear infections. Why is that important? Because if you keep getting ear infections and there's lots of pressure and fluid in that ear, you can't hear very well. And so for development, that's super important for young children, that they be able to hear so that they can speak and so that they can learn in school. So if your child is having more than 3 or 4 ear infections every time, that takes about 2 weeks to clear up. That's a lot of time lost, for school or for learning. So sometimes children, we think they're very polite because they keep saying pardon. That was my son. He kept saying pardon me when he was about 3 years old. He had a middle ear infection that was chronic, and he needed tubes in the end. So
is it painful?
The tubes? No, not at all. The child goes to sleep. They put a tiny, tiny little whole and they wake up and they're fine. They don't feel anything at all. No, nothing.
That's good to know. All right, the next question is, can using Q-tips regularly contribute to ear infections? And we kind of touched on that earlier.
Right, so it can contribute to the otitis externa, that's the swimmer's ear, not to the middle ear infections that we just finished talking about, but to the skin infection, because when you keep digging in there, you're sort of scratching it, and then germs can get into the skin, and you can get a swimmer's ear more easily. So we always come up with that question: how do we remove the wax? You can buy earwax melting drops that over the counter. They're about $3. Just look in the pharmacy for wax melting drops, and you can put those in a couple times a week. After you put them in, put a little hot pack, because again that will help melt the wax, and then you can flush it out with either a bulb syringe or just basically with your shower head. When your child or you are in the shower, just put, jet the hot water in there, and that'll help clean it out. So that's an easy way to get rid of wax, very gentle, and you can do that on your own. Or if you're using the oil, we talked about that, or if you're just using a cotton ball or a light Q-tip just on the outside.
Okay, and our last question is, how can I help alleviate some of the pressure in my ears?
Pressure, okay, well, you might not have an infection to have pressure, right? We've all experienced that. If we dive down deep into the water, or if we're on an airplane coming down, we'll feel the pressure in our ears. It's very painful. So to alleviate that, there's the chewing gum, the equalizing that you can do by blowing your nose like that. Using nasal decongestants. So you can buy something called Afrin spray over the counter, and Afrin is a nasal decongestant. Now you can't use that all the time, but you can use it for up to 3 days in a row, just a couple of sprays in your nose to help open it up, and then you won't have as much pressure. And there's also over-the-counter medicine like loratadine, that's Claritin, or Benadryl, or Zyrtec, Allegra. These are all the medicines you can use to help you with allergies, because that's usually the main reason why you have pressure, is because you got too much congestion.
All right, Doc, thank you so much.
You're welcome.
That's good knowledge to have. Doc will be back again next week, and we will be talking about thyroids. You can send your questions to healthyliving@kuam.com. Stay with us.